Hi, I'm Sean Cray. I'm here at Cray Physical Therapy, and I'm here with Dawn, our patient today, who came to us recently with about a 6-month history of right-sided arm pain. A few weeks ago, she went to see her doctor, who ordered an MRI of her cervical spine, and I'm here to discuss her findings and then also talk to you a little bit about what we're going to do treatment-wise with her moving forward. The major findings on her MRI were at C5 and C6 and C4 and C5 of her cervical spine. Basically, most of the MRI showed is arthritic changes in her spine, which led to what's called stenosis, which the narrow opening out here on the edge of the spine where the nerves come out, there's a little opening, and that when there's arthritic changes in the spine, that opening starts to close, and that's called stenosis. And what that does is it causes pinching of the nerves that exit out the spinal cord. And that pinching is what causes a lot of the symptoms or pain that's raining down her arm. At the time, Dawn was given an option of doing corticosteroid injections. She opted against that. Instead, she's decided to do a course of PT, which I've discussed with her on a prior visit, which will include some traction, which is basically the idea is to decrease stress on her spine. Also some range of motion techniques to also increase her mobility and hopefully decrease her pain. The plan is we're going to try this for about 4 to 6 sessions as kind of a trial period. If there's improvement, we're going to continue that way. If there's no improvement, obviously we'll reevaluate and possibly do some more medical management, but we're pretty confident that we can decrease her symptoms in that time period. So the first technique we're going to try today is called traction. Now there's various different ways you can achieve traction. Traction is basically just a separation of the spine or traction force on the spine, which causes some gentle separation between the areas of the spine where it's given her the most pressure. And basically what we're trying to do is decrease stress on that nerve that we spoke about earlier that's causing some of the symptoms down her arm. So what you're going to see me do here in a minute is going to be kind of hard to tell, but basically what I'm going to do with my hands is I'm going to provide like that gentle traction force to her spine. So what we're going to do is we're going to do it, and we're going to hold it for a little while, and then we're going to release it, and we're going to keep going back and forth like that, and she's going to let me know if there's any discomfort or irritation as I'm doing it. Ready, done?
Mm-hmm. Yep.
So I'm just going to give you a light pull. Feels okay?
Yes.
We're going to release it. Another light pull. Release it. Now there's, like I said, there's different ways you can achieve traction. There's machines that can provide the same type of force I'm applying. What I like to do is I like to use my hands, although it's a little more difficult on me. I think it also provides a little bit better treatment overall if you can do it, because the patient is relaxed a little bit better and they feel a little more comfortable in my hands versus the machine that's kind of strapping them in. So. So the next technique we're going to try today, a lot of times when people come in with the type of condition that Dawn here has, where there's pain raining down her arm and her spine is inflamed and it's causing a lot of spasm in the muscles around her spine, we call that kind of guarding. A lot of patients become muscle guarded, and it causes a lot of restriction to mobility in her spine and also muscular flexibility as well. And so patients kind of come in with this guarded, tense state. And so what we try to do is we try to relax them. We try to get the muscles around the spine to relax so that we can actually get a little bit more mobility in your spine later on when we do some different exercises and different stretches. So what I'm going to do today is I'm going to do some muscle work on some of the muscles around her spine that are tight to hopefully get them to relax, so that then later on in the hour we can move her a little bit easier so she's not so restricted. Just let me know if any of this bothers you, okay?
Okay.
Obviously, I'm feeling around. I've already done this on my assessment during the evaluation, but I'm also feeling around for any areas in her muscles that are a little more tight or irritated, and I may spend a little extra time working on those as they come up. Otherwise, I'm just doing some general techniques to try to, again, alleviate some of the tension in the muscles so that later on I can stretch her a little easier. All right, so now that we've decreased some of the tension in Dawn's spine by decreasing some of the muscle tension, but also providing that traction that we spoke about earlier, now what we're going to do is try to work on her mobility a bit. Now, there's obviously different ways you could do this. This is very early on in her treatment. She's not moving in a pain-free manner yet, so basically what I'm trying to do is get some early motion in her spine because she was quite restricted during the evaluation. Again, in a pain-free manner, because like we were speaking about earlier with that right-sided narrowing of her spine, if I move her into certain directions, especially a lot of times to her right, that can actually close down that space that's coming out, that nerve is coming out that right side. So I don't really want to do that. So instead, what I'm going to do is focus on improving her in a pain-free way, maybe away from that side for now, until we can get her symptoms more under control, and then kind of gradually move her into those more those ranges that are maybe a little more tough on that nerve. So we're going to start by doing just some gentle passive range of motion of her spine, and then I'm going to jump into some stretching of specific muscles around her spine as well. So just again, let me know if any of this bothers you.
Yep.
So by doing it this way, I can have full control of her. She's totally relaxed, and she's not really helping me along the way. So I can also feel tension if it's there in her spine along the way as well. So I can feel those spots where she starts to tense up, and that's when I kind of stop, and I don't push a ton through that motion just yet. Because again, it's early on in her treatment. We're trying to get her pain down. We're not trying to increase her pain. We're just trying to get some, like I said, gentle mobility, increased mobility in her spine. And as it tends to happen, she loosens up a little bit as we go, and then we can push a little further into those ranges as it allows. So typically our treatment sessions here are about an hour long. Obviously here in the early going, a lot of it we're focused on is hands-on, trying to decrease Dawn's pain. As she progresses, as her symptoms decrease, we're going to progress her treatment as well to more active based treatments, active based exercises. Please follow us along through her progress as things advance, and we're going to show you some other cool things along the way.